Last time I don't ask for help. So that's one bad part. I really like action lah. I can't cry as a man, boy can't cry.
Felt miserable, and I just knew that, okay, you need to stop. You need to really seek help, because you really deserve better. That was what I told myself.
I never knew of a possibility where I wouldn't be so tormented by suicidal, low self-esteem, thoughts of being worthless. I never thought that I would one day be able to cope it so well.
In the previous episode, we heard from youths about what affects their mental health and what it's like to go through those struggles. One of the most important things that we learned from them was resilience. And no, it's not just about staying strong, but it's finding the courage to seek help and pushing through every roadblock along the way.
When I tried to open to them about seeking therapy, taking medications, to them it's like it doesn't exist in the dictionary.
At one point, I was taking out 3 jobs on campus to try and sustain this, psychotherapy treatment.
The counsellor was not exactly patient anymore. My privacy was actually not taken care of, because she would tell my parents and teachers stuff.
How can we support a young person who's struggling with their mental health? And what's needed to make sure mental health care is more easily available for them? I'm Chiu Tong, and together with my colleagues Christy and Ryan, we spoke to a dozen Gen Zers, parents, advocates, medical experts on the lessons they've learned. Take the first steps with us to find out what they think needs to be done. To dive into the challenges that youths face in seeking mental health treatment, we are bringing in Karen.
I didn't have that.
At 23, she's been grappling with depression since she was 16, and she's experienced what it's like to search for support from family, friends, school, and healthcare professionals. A psychology graduate, she wants to inspire others who are struggling. In an ideal situation, I believe that youths with mental health struggles would turn to their parents first, right?
I took a long while to tell my parents about my struggles actually. I didn't really have that warmth and that comfort from home, because when I was stressed out, the first person that I would turn to was my mom. And she would actually say things that would make my stress even worse. Oh, if you don't do well in your exams, this is going to be terrible for you. I think I'm not alone. From my own experiences with my friends, I often hear the sentence, oh, if I go to therapy, don't tell my parents, which I think is a big issue.
Yeah. This is something we hear quite often from other Gen Zers. And even if they do try to tell their parents, the response that they get sometimes make things worse. Uma was in secondary 1 when she started hurting herself due to academic stress and bullying. And when she shared her struggles with her parents,
It's etched into my mind. My mom took out her metal pot and then she started hitting me. My dad was sort of disappointed. He just walked out. My parents weren't exactly very good at understanding mental emotions. I mean, they also have struggled similarly, but they were just told to don't cry, just suck it up. They also did the same to me. I just felt numb because I didn't expect anything better.
when Zhinan tried to tell his parents he wanted to get help for his panic attacks and depressive episodes, they thought he had been possessed.
They said oh, there's demons living within me. My parents actually lied to me, saying that, you're gonna visit a friend, but it turned out to be an exorcism. So it just kind of sprayed water all over my body and then expecting all the negative energy to expel so that I won't be depressed. They started chanting a lot of things, and then they started to rock my body very violently. It's so traumatizing. I just felt, what's the point of living if the people around me don't even understand whatever I'm going through,
Parents themselves are not quite so sure of how to have these conversations. I think it is also recognizing when the parents themselves were children and how society looked upon mental health. They have internalized messages that this is not appropriate, or this is something that is just about being stronger, or about character deficiencies or otherwise. And obviously no parent would want to see their child struggling.
来，come，你要吃哪一种？
Karen's mom was one of those parents who found it hard to accept that her daughter had depression.
我的朋友也有得过忧郁症，他们是完全是没有出去外面了2-3年，然后我就觉得我女儿跟她的状况是不一样，因为她每天还是一样，吃饭啦、出去啦、跳舞啦、上学啦。
Karen was in fact depressed and anxious from being cyberbullied by schoolmates and overwhelmed with the stress to perform well academically.
我想到的是，我的女儿是一个什么事情都会讲出来，很开朗的一个孩子。我再怎么想，她都不会，得忧郁症。那时候当下是很压抑，不能接受。
This is basically for her debating championship. These trophies. Originally, I didn't pay much attention to them.
When Prashant's teenage daughter was clinically diagnosed with depression, he couldn't accept that he was an underlying cause of it.
She spoke about how I had not been a wonderful father, how I had never been there for her, or how I had not been able to support her with a lot of things, how I had been lecturing her on her studies. Every time she would talk to me, I would just come back to her and say, like, why don't you study? Why don't you do this? Why don't you do something with your life? So the first thing was to reach out to a few friends who are medical doctors and psychiatrists, and I reached out to them over phone and said, like, how difficult it is to get out of. Is she going to be able to lead a normal life? They were very clear in telling me that, look, this is going to take time. This is not going to go away overnight. And they were very direct in telling me that before you try to change her, change yourself. I need to change myself. I'm perfect. So there was another feeling of resentment. Oh, you have done your best for your child and you have given them the best of care. How could this happen to my daughter?
Why do you think there's this resistance from parents? So as a parent, the primary aim is to protect, to nurture, to guide. So when mental health issues come up, it's like uncontrollable, it's like where did it come from? It's too big, it's massive for them. So the helplessness, I feel, gets in the way. So we either then want to problem solve without listening, or we want to dismiss without helping.
Bye-bye.
When Karen started going to therapy, Mrs. Lee thought that would solve the problem. But it didn't really. Not until they had their first real heart-to-heart talk. Karen learned that the key was to open up calmly to her mom, instead of fighting as they usually did. Because for the first time, Mrs. Lee really heard what her daughter was saying.
然后，甚至可能他就用比较专业的东西来跟我讲说，为什么会造成妈妈你对我的严格？对呀，他的问题有一些来自我。我得了，他知道我得了。当他去看心理学家回来的时候，因为我们都会分享，所以他有跟我讲说，我小时候对他太严格，甚至我有打他。其实这个我也是蛮后悔的。我觉得啦，如果重新来过的话，我觉得当爸爸妈妈应该都不会这样做。因为我觉得爸爸妈妈对我的要求也是比弟妹们要求的高，所以我也是觉得，所以我对他的严格的要求也是超级严格。我跟你讲，我们到现在不知道，即使我自己心里也是有问题。
Initially, when I heard about what she had been through, I felt very sad because it is a painful experience and it gave me more sympathy and also, most importantly, empathy for her background and also why she was so strict to me when I was younger.
很多东西真的要学习。父母如果真的有这样的孩子，不要怕，要去接受他，而且要勇敢的去帮助孩子。
And we're also going to talk about some of the skill sets, such as the 5 steps of active.
Learning to admit that he could be wrong was also Prashant's first step to helping his daughter get better. He attended a free 12-week course by Caregivers Alliance for those caring for people with mental health challenges.
Another benefit would be strong emotional bonding, so that they can actually really learn to express their emotions, right? And this is where I really want to emphasize that you guys play a very important role as their role models as well, right?
I was focused on making sure that they were well taken care of in terms of materially and physically, but I had not spent enough time in building that rapport with her. I started admitting my mistakes and I apologize for being a lousy father, for not understanding her, for putting her through the pain. You know, you have to lower down your ego to the lowest level to be able to go out to your own children and say, I'm sorry.
If you're a parent who's not sure how to talk to your child about their problems, there are some resources that you can turn to besides Caregivers Alliance. And these are support groups in a community run by Club Hill and Caregiving Welfare Association. But sometimes taking that first step can be as simple as spending more time with your child.
Just being the same space as she is. You may not talk a lot, but you can just be physically there. One of the hobbies I picked up was watching Korean dramas with her for the sake of the fact that we had something common to do together. It is something of a way of saying that, you know, okay, I'm here for you and I am open to doing things which you like.
When you're going through mental health struggles, right, do you think you rely more on your friends than your parents?
My friends were also able to relate better with me in terms of my challenges, being, very stressed in school, and also they were the people that I actually approached first to tell them about my issues and what do I do to seek help.
Initially, I wasn't actually coping. It's when I started with like the self-harming stuff. Then I met my best friend and I had someone to talk with. She was someone willing to listen to me. She got my back. One time, like, the bullying in class actually reduced me to tears, and like, she essentially sent me out the back door and then started scolding the class for doing that to me.
For a lot of youths, when they hear their parents saying such, they feel like, okay, so you're pointing out to me that I'm a problem. Whereas when they hear it from their peer, they're less likely to take it as defensively and see that, okay, you care and see that I have a problem and it's not because I am one.
That's why peer support programs in some schools, polytechnics and universities train folks like Wen Hao to look out for fellow students in distress.
It seems to me there's a lot of fear, a lot of doubt about basically what your future is, especially understanding you're year 3, right?
I would say in the past I was very solution oriented. Like the problems may be very complex, I would just try suggesting like different solutions. And I think the first thing that we were taught in peer helpers is actually not to give advice and instead to just listen and to understand what the friend needs. They're more actually looking for somebody to listen to them, to empathize with them, or maybe for themselves they want to like just vent their feelings.
The Caregivers Alliance provides free training for young people who want to better support friends going through mental health challenges. Other similar programs would include the Peer Support Specialist program by the NCSS and a Healing Friends training by Club Hill. There are also mental health mobile apps out there that help with self-care through mindfulness exercises, AI chatbots, and can even get you connected to a therapist online. But what about the one place where teenagers spend most of their day? School. So I do think that friends can help to a certain extent, but I think unfortunately for some people, they would need more help from a professional or a trusted adult. And I guess in a school setting, naturally we would think of school counsellors and teachers.
I think the fact that school counsellors are in the school premise itself is a very useful and plus point. And also, the cost of school counselling is much cheaper than going out for to seek psychological and professional support. However, in the reality, it's not the case, right? In my own experiences, I did see a school counsellor before, but it wasn't very useful. I remember having the thought that, oh, my school counsellor is giving me very generic advice.
Like, for example?
Very straightforward, like, oh, I'm feeling bad, then, oh, how about you just think about other things that are positive.
Right. In fact, the issues that youths have with school counsellors has spawned several threads on Reddit. And when we put out a call on Instagram for young people to share their experiences, we got a lot of responses about how they felt counsellors belittled their problems or snitched on them. Responses like, they were very patronising. I felt like a child that's not taken seriously. Counsellor dismissed me after 3 sessions. I was told I'm just lazy and I should not waste her time.
Hi girls, come in.
This is why some schools like Crescent Girls' School take steps to make the counselling process more transparent.
At the beginning of the year for the Sec 1s, we always will arrange for this program called Get to Know You. So they come in groups of 10, just a very informal chit-chat session with the school counsellor. The main idea we wanted to send to the girls is that they do not see the counsellor just because they are in trouble or because they are not coping. It's that first impression that I'm a friend, that you can always come to me if you need somebody to talk to.
In fact, one of the few positive reviews we saw online came from a former Crescent Girls student who saw her counsellor for 3 years and looked forward to every appointment where she could vent her frustrations and get helpful advice in a diffuser-centered room. Efforts were also made to destigmatize seeking help.
We try to always tell the girls that it's a choice. Even if it's because they have been referred, they come in with that understanding that they are not forced to talk about anything.
But given the ratio of about one counsellor to roughly 800 students in many schools, it means that they also face heavy caseloads, and meeting the needs of every child becomes a challenge. When a student may need more care than a school counsellor can provide.
The child is not coming to school. Sometimes it could be because there are other family challenges. Generally, we will probably reach out to REACH first.
So we have a program called REACH, which is really embedded within the school system. We work very closely with the counsellors in the schools. So we have our teams consisting of psychologists, social workers, OTs and doctors. What we see are signs of that these symptoms are not going away. They are getting worse and it's affecting the individual's sleep, appetite, energy levels, ability to function in school. That then we feel that it requires more in-depth assessment and possibly use of medications to get them better. It's only more complex and what we call as tertiary care that we escalate to IMH.
While the IMH is the only psychiatric hospital in Singapore, there are other public hospitals with psychiatric departments that a young person can go to for help. And yet,
I went OMG actually when I saw the number because we found that 90% of the respondents under the age of 24 stated that they ever had mental health challenges. Out of this number, only 50% of them sought help. 79% of them actually disagreed with the statement that says, I think the public mental health care system in Singapore is satisfactory.
Strong mental health support at schools and workplace directly.
Former nominated Member of Parliament Anthea Ong started SG Mental Health Matters in 2019 to advocate for better accessibility to mental health care. Last year, they wanted to find out how Singaporeans perceived mental health policies. So they put 561 people from social media platforms and community mental health groups.
The youth respondents would share about their unpleasant experiences when they sought help at public hospitals and healthcare institutions. And some of this even included restraints that were used on them, that they had to be warded, and obviously bearing witness to the suffering that they saw, right, with the other patients. And of course, there were a lot of fear too.
I was literally stationed with a few other patients who are of similar or even more severe conditions than me. There were a lot of persistent triggers.
Stories like these over the years led to the IMH to set up focus group discussions with their younger patients to find out more about how their experience at the hospital can be improved.
About 5 years ago, we started 2 new wards. So one is our child and adolescent ward, which takes in those until the age of 18. And then we have the early psychosis ward, which takes in young people between the ages of 16 to 40 with first episode psychosis. So this is their first time they're coming for major mental illness.
The IMH is also rolling out trauma-informed care training for all its staff to ensure that patients feel emotionally and physically safe when they visit the hospital.
Because many of the young people who come have had past issues with trauma, they have been bullied in school, they have gone through emotional or even sometimes physical trauma. So our services should not be, in addition, traumatizing.
And some youths are also trying to change the narrative on social media. Jermaine, who has depression, anxiety, and post-traumatic stress disorder, took a gap year from school to focus on her recovery and treatment at the IMH. However, when people asked her what she was up to, she would avoid answering the question for fear of stigma.
I have depression.
Talking to a lot of different people and growing up, I always have this image that IMH is like very scary, and it's like a place where only like people who have like really bad mental health illnesses go to.
Go to IMH with me.
So when I actually first went there, right, I was actually very surprised that it looks like a normal place, you know. Yeah, and everything there is like very colourful, very friendly. Yeah, so I wanted people on TikTok to like see that this place is not scary actually. This is how it looks, because they don't know. I felt like posting there, it was like, personally, it was like a declaration for me that like I'm finally okay and I got in terms with like this whole thing.
So I was speaking to someone about how I felt when I first started.
Zoe, who goes by Elephant and Mangoes on TikTok, also posted about her treatment for complex PTSD.
I think mainly what I try to do is just destigmatize the place. And I realized that there's actually so many people that really want to seek help, but they just don't know how to do it.
To get professional help for your mental health, you can visit your nearest GP or polyclinic. If need be, they can refer you to a mental health specialist at a public hospital, and any treatment there will be subsidized. You can seek treatment directly from public hospitals with psychiatric departments, but in this case, any treatment will not be subsidized. If your need is urgent, there is a 24-hour emergency department at the IMH.
I never knew of a possibility where I wouldn't be so tormented by suicidal, low self-esteem, thoughts of being worthless. Psychology sessions have just given me the ability to know what to do when it happens, you know.
So there is a system in place for youths to seek help, I think, which is great. From the conversations that I've had with youths, I think one big issue that they've pointed out is the fact that it's a very long wait list. Is that your experience as well?
Yeah, definitely. I remember when I was trying to seek help at the Child Guidance Clinic, IMH, I had to wait for about 1 month to see a psychologist. And the experience of waiting 1 month to get my first session made me feel more hopeless in the situation. Because I was at my wit's end when I made the decision to seek help, right?
And you're not the only one, because according to statistics that I found, right, in 2018, the average overall median waiting time for new subsidized appointments across public hospitals was 27 days to see a psychiatrist and 28 days to see a psychologist. And similarly, for IMH itself, it was 29 days to see a psychiatrist and 18 days to see a clinical psychologist.
When I reached out to IMH sometime in April for an appointment, we were told to come in August. And I said, like, really? Like, I need help now and you're telling me to come in August. I think no matter where we went, the facilities were super booked, whether it was the NMH or IMH, and you have to wait for like at least 3 to 4 months.
The IMH says that waiting time has been longer since the pandemic, as safe distancing measures had reduced hospital capacity. Non-urgent cases also had to be deferred as a result.
What we have put in place is now we triage the cases. So everybody who's referred, a doctor goes through the cases and a nurse will call them. So those who need immediate treatment, we'll see within 2 to 4 weeks. Unfortunately, some of the maybe moderate or milder cases may have a longer waiting time.
The MOH said that IMH monitors appointment waiting times closely and has measures to optimize appointment slots. For example, non-urgent cases are referred to primary and community-based care providers, which include over 220 GPs and 14 polyclinics providing mental health services. But what happens when youth's mental health issues are not addressed as soon as possible?
When it comes to why I work with this youth population. So if I catch them at this stage where they only have 20 years of experience, I don't want to wait for them to have 40 years of experience before I help them then. And that will be like, not too late, but it will be so many things to unpack and unlayer and relearn.
To get past the long wait list in a public healthcare system, some may choose to seek help in a private clinic or hospital. But there's one catch. Treatment is much more expensive and there are no government subsidies.
So there was definitely waiting for 4 months was not an option for us. So we were fortunate we could afford stuff, and so we went private. Expensive. If you were to look at psychiatrists plus therapists plus medication, 2 sessions a month at least, you would end up spending a couple of thousands, at least 2,000 plus. This could be for years and years and years.
But not everyone who needs help fast can afford this premium. Jasmine's daughter, who has had major depression disorder since she was in primary 5, met with up to 8 psychologists at the IMH, but could not find one she could click with. When her daughter was unable to cope with her suicidal thoughts, Jasmine admitted her to a private hospital.
You can see the difference. She's healing better. For her medical bill, her 3 weeks there, we spent about 26K. That is after minus the Medisave.
According to MOH, total Medisave claimable for inpatient psychiatric episodes is up to 150 Singapore dollars per day and a maximum of 5,000 Singapore dollars a year. That is compared to other inpatient episodes where individuals can claim up to 550 Singapore dollars for the first 2 days of admission and 400 Singapore dollars per day from the 3rd day onwards.
Her average monthly medicine cost is about 1,000. It's like wipe up all our savings.
Meanwhile, some private practices and counselling centres are making their services cheaper for youths or individuals with financial difficulties. At Thrive Family, fees to see a therapist are tiered and can start as low as 5 Singapore dollars. Some social service agencies like the Counselling and Care Centre and Shanyo offer means testing so that counselling fees can be more affordable. The CHAT, or Community Health Assessment Team run by the IMH, directs youths to where they can find these services.
So our thought is that if the child doesn't need to come to a hospital level and can be handled and managed at the level of the home, community, then we try to do that.
CHAT started in 2009 to serve 16 to 30-year-olds. It also conducts mental health checks for free to encourage youths to seek mental health help early.
So we thought that having an assessment center outside of IMH where they would be able to walk in and get an assessment for themselves. They wouldn't need to ask their parents because we didn't insist on parental consent for above 16. We also did not register them as patients within IMH. So then they kind of felt more safe to walk in and get that assessment that they needed.
Once an assessment is done, CHAT counsellors will recommend the next course of action, whether to see a counsellor in the community or seek further treatment at the hospital, or at a subsidised rate. Besides helping youths get timely treatment, some community groups are focusing on equipping them with healthy coping mechanisms.
I want you to feel the breath, okay? So now close your eyes and then take a deep breath in and out.
Naresh is the co-founder of Impact, a non-profit organisation made up mostly of psychology and social work undergraduates. They provide support to vulnerable youths.
He is a boy that has been not so motivated to go to school, and he has been experiencing some low moods. This is my 5th session with him. The volunteers are really there to see how we can stabilize them in that moment. From distress tolerance to emotional regulation. So whenever they face problems later in the future, they should be able to use these coping skills to help them.
Mental health waits for no one. Who can I look for is the big question. We are trying to provide that space where youths can be supported, youths can be heard, and there's someone to journey with them until they receive a professional support, or even through receiving a professional support, there's someone there.
Social media platforms like TikTok are also stepping up. They started the Youth for Good program to raise awareness about mental wellness and to help youth support each other.
First off, I'd like to say that you should be really proud of yourself for the fact that you're trying to do something with your mental health journey.
So let me share some mental health resources that you can find right here in Singapore.
If there's a key message that you would like to share with other youths who are watching this documentary, what would it be?
There is a lot of strength in seeking help, in taking that first step, because mental health is equally as important as physical health.
For a lot of youth that have come through my doors, right, I'm not their first psychologist. You know, they have been through a couple others, or counsellors rather, who may or may not have, vibed with them. And that's okay. But I think if they try and get to at least get some help in certain places and don't give up, right, they will find someone and they will get the help that they need. And it would be sad if they didn't give themselves a chance to get it.
My suggestion to parents is if you think there is a magic pill through which if they take it and they're going to shake it off, it's not happening. If you think there is a therapist who can talk them out of getting out of this condition, it is not happening. The only thing that is going to happen is through your support, through your empathy, through understanding, which will help you build trust and confidence in your loved one, and then you can slowly walk your loved one out of this situation. That's my message to every parent.
谢谢妈咪。从我跟你讲我需要帮助时候，你 support 我，也是没有一直指责我跟骂我。然后我跟你讲话时候，你有开放的心情来听我讲的话，
让我们变得更好。
Thank you for watching. We hope this has been helpful to you. If you have yet to watch the first episode, click here. Also, check out our list of mental health resources in the text description below. And if you have your own experiences you would like to share with us about mental health, do drop us a comment as well. Take care.